Most people think Medicare is simple. You turn 65, you sign up, and that's it. But if that were true, millions of people wouldn't be confused, stressed, or accidentally paying penalties every year. The truth is, Medicare eligibility is one of the most misunderstood parts of the entire healthcare system, and if your situation doesn't fit the normal retirement timeline, things can get complicated fast. Maybe you're still working, maybe you're under 65 with a disability, or maybe you've been sick and didn't realize you already qualify. In this video, I'm going to help you solve the Medicare eligibility puzzle and show you hidden paths that many people miss. Paths that could save you money, protect your health, and give you peace of mind. Let's start with a big myth that causes a lot of confusion. Medicare is not only for people who turn 65. Yes, that's the most common way people become eligible, but it's not the only way. In fact, thousands of Americans are already eligible for Medicare without realizing it. Some people qualify years before 65 because of disability or serious illness. Others delay enrollment because they're still working and then panic later when penalties show up. The key is understanding where you fit, because Medicare rules are based on your situation, not just your age. If you're under 65 and receiving Social Security disability insurance, Medicare eligibility can arrive sooner than you expect. Once you've received SSDI benefits for 24 months, Medicare automatically begins in your 25th month. You don't have to apply again. Your card just shows up in the mail. But here's the pain point. Many people don't realize this until it happens, and they're unprepared to choose coverage, compare plans, or budget for premiums. Even worse, some people miss important enrollment choices because they assume Medicare only starts at 65. If you or someone you love is on disability, this is a critical moment to prepare, not react. Now let's talk about serious medical conditions that unlock Medicare even faster. If you've been diagnosed with End-Stage Renal Disease, also known as ESRD, Medicare eligibility can start immediately. There's number 24-month waiting period like SSDI. That's because dialysis and transplant care are extremely expensive, and Medicare steps in quickly to help cover those costs. But many patients don't know how enrollment works, or they assume their employer insurance is enough. Without proper coordination, this can lead to denied claims and massive medical bills, right when stress is already high. Another fast-track path is for people with ALS, also known as Lou Gehrig's disease. If you're approved for SSDI because of ALS, Medicare starts the very first month you receive disability benefits. No waiting period at all. This rule exists because ALS progresses quickly and requires immediate ongoing care. But again, the problem is awareness. Families are often overwhelmed by the diagnosis and don't realize that Medicare is already active, or that they need to make coverage decisions immediately to avoid gaps. Now let us shift to a scenario that confuses millions of people every year. Working past 65, many seniors are healthier, active, and still employed, which is great, but it creates Medicare confusion. If you turn 65 and still have employer-sponsored health insurance, you might not need to enroll in Medicare right away. But that depends on the size of your employer and whether your coverage is considered creditable. This is where people make expensive mistakes. If your employer has fewer than 20 employees, Medicare usually becomes primary at 65, and if you delay Part B, you could face lifetime penalties. If your employer has 20 or more employees, you may be allowed to delay without penalties, but only if your plan meets certain rules. This is where the special enrollment period becomes your safety net. When you stop working or lose employer coverage, you get an 8-month window to enroll in Medicare Part B without penalties. Here's the catch. This window is not automatic. You have to take action, submit forms, and prove you had qualifying coverage. Miss this window, and you could pay higher premiums for the rest of your life. That's not a small mistake. That's thousands of dollars over time. Another overlooked issue is prescription drug coverage. Many people assume their employer plan covers drugs the same way Medicare does, but if your plan isn't considered creditable for Part D, you could also face penalties when you eventually enroll. This is why reviewing your coverage every year matters, especially if you're working past 65. One wrong assumption can follow you for life. So how do you put all of this together without feeling overwhelmed? Start by identifying which path applies to you. Are you turning 65 soon? Are you already receiving SSDI? Have you been diagnosed with ESRD or ALS? Are you still working and covered by an employer plan? Once you know your category, verify your eligibility directly with Social Security or Medicare. Don't rely on assumptions, coworkers, or even well-meaning friends. Medicare rules are too specific for guesswork. Next, gather your documents early. If you're working, you'll need proof of employer coverage. If you're on disability, watch for your Medicare card and prepare to make plan choices. If you're dealing with a serious illness, speak to a Medicare counselor or insurance professional who understands coordination of benefits. Free help is available through SHIP programs in every state, and they can guide you step by step. The most important thing to remember is this: Medicare mistakes are expensive, but they're also preventable. With the right information, you can enroll on time, avoid penalties, and choose coverage that actually fits your life, not someone else's. You deserve healthcare that works for you, not against you. Now I want to hear from you. Which situation are you in right now? Turning 65, working past 65, or qualifying early because of disability or illness? Drop a comment below and tell me what part of Medicare is confusing you most. If this video helped clear things up, give it a thumbs up and subscribe to Medicare Made Easy for Simple. Honest guidance that helps you make confident decisions. Thanks for watching, and I'll see you in the next video.